अस्सलाम वालेकुम। कैसा मौसम है बेयकीनी का, फासले इन दिनों शिफा ठहरे. That's why we are on Zoom today. Welcome to our Dogana panel discussion. I'll be your moderator. My name is Naushaba But I'm from class of 89, chair disaster committee Dogana, counselor Pacific Coast, for the last 20 years affiliated with United Medical Imaging, Los Angeles, California. We have our president, Dogana 2021, Dr. Irfan Aslam with us. I will ask him to give us a little overview about Dawahid's Association of Dr. Irfan Aslam, he is from class of 1992, and he is a cardiologist in Florida and in private practice for almost more than 20 years. Dr. Irfan, please. Tell us something about Dogana.
Dear Dawahids,
you start.
Dear Dawahids, friends, colleagues, and my esteemed panelists, Assalamu alaikum. 2020 has been a very significantly difficult year. In March of 2020, the world turned on a dime and we were forced to face great tribulations and rise to extreme challenges. As is often the case, that in times of hardship, we take hope from incredible examples of human resilience, innovation, compassion, and cooperation, which has emerged from this pandemic. Dawahids all over the world, in Pakistan, North America, Europe, Middle East, Australia, New Zealand, worked tirelessly hard and provided a quality healthcare to sick individuals during this pandemic. Many of them lost their life. We applaud their efforts and pray for them. Dogana stands for Dow Graduate Association of North America. I've been with Dogana for almost a decade. I'm a president this year. I want to tell the state of Dogana is strong and vibrant. I want to highlight some of the things that we do in Dogana. Dogana, Dawahids are always our philanthropic trailblazers. The core value of Dogana believes in donating and giving back to homeland and even here in communities in the United States and Canada. Most of our classes who are seniors, they are already running some projects with donation and charities. And we are always asking our junior classes to come up with some projects so Dogana can execute them with their help. The flagship project for last couple of years is Dogana Institute of Genomic Sciences. We welcome Dr. Zarnaz here. We are in collaboration with Dow University of Health Sciences, and we have collected almost $300,000 so far. And the pledge will be close to $500,000 as we go further. And we will be giving good news to our Dawahids in coming months. Number two is it's imperative for Dawahids, younger Dawahids to get help from Dogana. We have a very strong loan program where we help them financially with higher scholarships, visa help. When they come here for interviews, we provide them some opportunities for so they can stay with somebody and to fulfill their dreams like we did. Beside that, we have a very strong CME program that we do every year in the United States and Canada, and very robust visiting faculty program where our very talented, accomplished, well-published Dawahids go back home and share their expertise. Beside that, we work very closely with NGOs like OBAT, eDoctors, Child Life Foundation, and recently we signed a MOU with American University of School of International Service. And in that particular MOU is not for Dawahids who are coming from Pakistan. These are the young girls who need some mentorship and some experience here in the United States, and Dawahids and Dogana are ready to help them out. I want to shout out to two people, especially before I give mic back to Naushaba. One is our IT director, Laik Siddiqui, who is instrumental in all these meetings and help us out. And then the backbone of Dogana, Dr. Nadeem Qureshi. We will not shine without him. This is true. I will end up by saying that we believe strongly that if your intentions are focused and true, and you meet your challenges with intelligence and creativity, we will prevail. Thank you so much.
Thank you so much, Dr. Irfan. And वो किताबों में दर्ज था ही नहीं, वो किताबों में दर्ज था ही नहीं, जो पढ़ाया सबक ज़माने ने. Topic of the day: COVID pandemic beyond 2020 in Motherland and Homeland. As COVID continues, scientists start learning more about COVID, how it will affect on our health in long term. And it does not affect only respiratory system, it affects multiple organs with blood clotting and inflammation. Sometimes COVID symptoms can persist for months, and that the term called long haulers. We have so many questions and concerns. We will get answers today. I'm joined by honorable panelists who are experts in their field. So I think this is my duty right now to introduce my panel to you guys. The first panelist is Professor Nadeem Qureshi. He is Fellow of American Academy of Pediatrics, Fellow of American College of Critical Care Medicine, Professor Pediatrics, School of Medicine, St. Louis University, Director Quality Management Pediatric Emergency Medicine, Cardinal Glennon Children's Hospital, St. Louis, Missouri. I was okay, Dr. Nadeem? Are you okay?
Yes, you did.
Thank you. Let's go to our second panelist, Dr. Sanober Kable Butt. I like her because she has my name. She's a pulmonologist in Denson, McKinney, Gainesville, Texas. She specializes in pulmonary and sleep disorder. She also practiced critical care medicine and working as a chief of medicine Texoma. Welcome, Dr. Sanober.
Yes.
We will go to the third panelist, Professor Shahid Husain. Professor Shahid Husain, he is a professor of medicine, Director, Transplant Infectious Diseases, Division of Infectious Disease, University of Toronto, Canada. Education Director, Ajmera Transplant Center. Welcome, Dr. Shahid, Professor Shahid Husain. How are you today?
Good, thank you. Really delighted to be here.
Coming back to you. Our fourth panelist, our honorable fourth panelist. I want to say before that, उस्ताद बादशाह नहीं होता, मगर अपने तुलबा को बादशाह बना सकता है. One of our professor from Karachi, we are honored to have you here. We want to welcome you, Dr. Zarnaz Wahid. She is Meritorious Professor of Dermatology, Principal Dow International Medical College, Pro Vice Chancellor Dow University of Health Sciences, and CEO of Dow University of Hospital. Welcome, Dr. Professor Zarnaz Wahid. We are very happy, honored to have you here with us today. Thank you so much. Now we will introduce our fifth panelist, Mr. Abdullah Butt. Welcome, Mr. Abdullah. How are you?
I'm fine. Thank you very much. Thank you.
He is CEO of Educast, digital health and telemedicine expert. He is working in Sindh government regarding contact tracing and home isolation, handling 70 million population since last 12 months by using eDoctor digital health services. He developed digital health service and virtual training platform. So we will start discussing the program. Before going to the next level of our program, before I have to invite my first panelist so we can start the discussion, I want to read one thing for him. देर लगी आने में तुमको, शुक्र है तुम आए तो, आस ने दिल का साथ न छोड़ा, वैसे हम घबराए तो. You know, this is for Dr. Nadeem Qureshi. Dr. Nadeem Qureshi, welcome. It's not less than a miracle that have you here with us today, mashallah. You got COVID when there was no set regime for its treatment. And you were on every single life-supporting machine, dialysis, ventilator, ECMO, which is a heart and lung supporting machine, and you survived. I think it all was because of good teamwork, lots of dua, and your determination that you are back. Alhamdulillah. One clap for you.
Alhamdulillah.
So, Dr. Nadeem, I want to start with you. I think we have to start the video before.
Dr. Nadine Qureshi has saved many lives, but never did he think that he would be fighting for his own, at least not like this. He got COVID-19, and the situation quickly went from bad to worse to dire. It's going to be a while before he returns to Cardinal Glennon. So today, Cardinal Glennon came to him. They were cheering on a rock star, a real-life superhero.
You see those first glimpses of him just taking it all in and recognizing, you see all these cars going by.
A huge surprise for Dr. Nadeem Qureshi. It wasn't his birthday, but it was a celebration of his life.
Such love and affection. It's just remarkable.
Wow.
The 55-year-old SSM Cardinal Glennon pediatric emergency physician was in the hospital for 40 days battling COVID-19. A majority of that time in the ICU. It was so serious, he was placed on an ECMO machine when his lungs and kidneys failed.
He was fighting this battle alone in a hospital. You know, we were all praying. His Glennon family was praying.
Dr. Qureshi is respected locally and across the globe. He's opened pediatric clinics in his native Pakistan and spoken at several international medical conferences. And while COVID-19 brought his life to a halt, it also brought an outpouring of love, hope, and prayers.
Some for me in a variety of ways all over. And that's why I made it back home.
I would have never imagined how fortunate I am to have a family like you. Of course, my family is here, but I think you guys are amazing. I have no words to express. I really can't.
It's unclear how Dr. Qureshi contracted the coronavirus. He was traveling overseas beforehand and was apparently asymptomatic for a few days before his condition deteriorated. He says he is forever grateful to his Cardinal Glennon family for its support. Jasmine Huda, Fox 2 News.
So it was a miracle, mashallah. It was so touchy. Dr. Nadeem Qureshi, I think we all must be very interested to know that what treatment options you were offered when you were in the hospital. Were they same as current recommendations? I'm going to compile my question with 2, 3, so you can just start and talking about it.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum to everyone. First of all, a word of thanks to the Dogana organizing team for allowing me to, giving me this opportunity to share my experience of a lifetime to ECMO and back with others. As the video pointed out, it gave you the idea that I got sick when there was not enough information available about COVID-19. In fact, people thought initially it was a respiratory disease, and now we have obviously learned it's a multi-organ disease. And so I think it's fair to say that when I got admitted to Barnes Jewish Hospital, they struggled, and my deterioration was so rapid that within 6 hours of my arrival to the emergency department, they intubated me. And within 5 days, I was placed on ECMO. And myself, an intensivist and ER physician, I have placed many people on ECMO, but not that rapidly. In hindsight, I think it was a great decision by the team to protect my lungs in the long term by intubating me so earlier on and then placing me on ECMO to try and help me see if I can recover from this multi-organ failure disease. And yes, at that time, I did not receive steroids because there was no evidence that steroids were helpful. So I did not receive steroids. I did not receive remdesivir because I had renal failure. But my credit to the Barnes and Jewish team that they, the lead person who was there, I would like to mention his name. He's another Dawite actually, Dr. Faraz Masood from the class of 2001. He was the chief of ECMO at Barnes and Jewish. And he went out to each and every place, especially to New York, reached out to New York, people in New York, to see what medicines or what treatment options are available for people like us. With barely few days in hand and almost on the verge of losing me, and with this multi-organ, I had a renal failure, a respiratory failure, cytokine storm. I had a hypercoagulable state, and I was heavily sedated and paralyzed with indeterminate neurostatus. So the mortality was like less than, more than 97, 98%, give or take. And with no treatment options, all they did was they scrambled their hands to figure out what they can offer me. And the first thing they came across was IL-6 blocker, tocilizumab. And the reason they picked that up was because all of us who have now learned about COVID is that my D dimer was more than 80,000. So the current status is that if it was more than 2,000, the mortality is already 50% to begin with. So they gave me IL-6, which was an experimental at that time, so much more of an investigational drug rather than a true treatment plan. And if you see the literature now, it's pretty much out of the order. But I can tell you that if anything made a difference in my life, it was the IL-6 blocker that turned me around. They had placed me on ECMO for a good 5 days, 6 days, and there was nothing which was working for me. And I remember my children telling me that Dr. Faraz ended up calling my son, oldest son, and saying, we have nowhere to go. This is a drug which may help him. It's worthy a shot. It can damage him too, but it's the only thing we see right now on the horizon. So they started off with that, and by alhamdulillah, by the grace of God, I turned around in 24 hours, which was a huge miracle. My numbers started to get better. My CRP, my serum ferritin, these numbers were astronomically high. The cardiovascular surgeon told me that they have never seen numbers like this. I had a CRP of 400, a serum ferritin of 1800, and a D dimer of 80,000. So those numbers were just astronomical. Nevertheless, so I got, basically I ended up getting, first thing I got was the IL-6 blocker. And then because I was not a candidate for remdesivir, they decided to give me convalescent plasma, which also helped me. And if you now look at the current recommendations, both of these things are pretty much low on the line. I mean, people talk about many other things now. The steroids have taken a role since the recovery trial came through. And the steroids are #1 choice to be given. Remdesivir is there. It has shown improvement or reduction in mortality. But I did not receive any of those therapies. For me, the only therapy was ECMO, IL-6 blocker, and convalescent plasma. And so my message, basically, I mean, what I would like to summarize from this small talk is, there are times as healthcare providers, we firmly believe that evidence-based medicine is the way to go. And I agree with that too. But you may be confronted at times when you may not have the evidence, just in like my case. So the answer is that, don't always rely on evidence-based medicine. Sometimes you just have to go through what is available and do the best what you can for your patients, and it will make a difference. And I'm a living example of that. I mean, if you were to look at my treatment regime compared to what the current guidelines are, I was nowhere close to what the current guidelines are. But yet, I think the hallmark to the Bonds team who took care of me, that not knowing a whole lot of the disease at that time, they just went out and did whatever was available, the best they could do, and helped me save my life. And really huge, absolutely.
We are very happy to hear that. I want to ask one little more question from you. That as we know that COVID, there's a long haulers term used nowadays for our symptoms persist for many, many months. So I want to know what complications has been persistent and how are you coping with them?
Well, thank you for asking that question. I think it has been a real challenge since I came home. After 40 days of hospitalization, I mean, I had whiteout lungs. Fortunate enough, when I came home, I did not need oxygen when I came home. But my resting heart rate was like about 130, which even today, after 6 to 7 months of physiotherapy and recovery phase, is still hanging out in the 90s. I used to have severe shortness of breath when I came home. I could barely move from one room to the other room. I still have sometimes difficulty climbing the stairs, but I've come a long way. And I'm not seeing, the back of my journey. I'm just seeing the forward time. So I have improved in the sense that, I can walk for 30, 40 minutes now, which was very difficult a few months ago. So my shortness of breath still persists, especially if I'm doing any dynamic activity. And an interesting thing, even as a healthcare provider, I would share that when I came home, I didn't realize when I was undergoing physiotherapy that walking and talking are two different exercises. So I could only do one at a time. Either I could walk or talk. And that was something which was an amazing understanding for myself, that how challenged a human body can be after an illness, that even doing such simple things of life, just walking and talking, is a challenge.
Very true.
So, and I still have, my myopathy was very significant. I mean, I was unable to, I came home, I would tell you this thing, that I could not handle my cell phone. I had tremors when I came home, actually. And I could not manage my cell phone. It was very challenging. And but now those are the things of the past, and I'm much better off. I was not able to bear lift any weight beyond 1 or 2 pounds at best, but now I can. And my shortness of breath, as I just mentioned to you, but I'm just I'm determined that I will. I've come so far, and Allah subhanahu wa ta'ala has been very kind to give me this life, this miracle, that I will be back to baseline at some point. I don't know how long,
you are determined,
but inshallah we will be.
Thank you so much. And lastly, I just want to ask you, answer me very brief, that any specific suggestion you want to give to those who are facing these complications nowadays?
Absolutely. Don't give up. Never underestimate the power of healing. Never underestimate the power of prayers. Prayers and healing will get you. Prayers for me, I think, was a #1 deal.
Thank you so much, Dr. Nadeem. We wish you and may God bless you with all long and healthy life.
Thank you. Thank you. Jazakallah. Thank you.
So, thank you so much. Now, I think in regards to Dr. Nadeem's context, I want to ask Dr. Sanober Kable some questions. If she is there, right?
Yes.
Yeah. Assalamu alaikum, Dr. Sanober, welcome. As early research shows that COVID-19 affects almost all organs, heart, lung, GIT tract, especially the lungs, and gives so many different symptoms with blood clotting and inflammation. Being a pulmonologist, can you tell us what are the post-COVID airway and interstitial complications and the role of antifibrotic therapy in these patients?
Thank you for having me. I would first start out with just saying that what Dr. Qureshi just mentioned, that, with COVID, especially when it initially came out, we didn't have a lot of evidence. Even now, I think evidence is still coming for more and more. Whatever was true in March is not true at this point of last year. So keep your eyes open, keep your mind open. And, every person is so different that you can't have a cookie cutter approach. And a lot of time you have to think outside the box if you have a patient like him that has numbers outside the normal range and the patient is not really responding to the traditional therapy. Now coming to the post-COVID after discharge complications, the way, the questions are perfect, because the way I see it, I would say more of the interstitial complications where pulmonary fibrosis, I think we have all heard of it, with post-COVID, which is different than IPF patients that we deal with. And there's a lot of research that's going to go into this, even in the future, we're going to hear from it. And then also airway complications. So when I see these patients, my first goal is, like he's saying, that he was more short of breath, and even the things like talking, walking, that we take for granted. And we don't, and our work of breathing, that in a normal person takes such small amount of effort, takes a large amount of effort when these patients have been on the ventilator, especially if they've been on the paralytics, they're going to take a long time to recover. So first step is the way American Thoracic Society and chest guidelines are at this point, that we should have a recovery plan. Even there have been some recommendation to have recovery clinics for these patients and do a baseline pulmonary function test and a 6-minute walk test at 6 weeks post-discharge. Then you do it at 3 months, 6 months, and at a year. It kind of tells you like how much recovery there is, because the one thing that gets affected with COVID patients is diffusion capacity. Even though they might be, like he's not hypoxemic. When he went home, he wasn't hypoxemic, but diffusion capacity can still remain impaired for up to 1 year. There also been some evidence that some of these patients with interstitial lung disease, that a small dose of steroids and azithromycin as an immunomodulatory agent could also help lung not remodel, where it will end up with chronic pulmonary fibrosis. But again, those are the things that need a lot more research before we can put it as an evidence-based practice. But you will see those patients where you will have to modify what just according to the patient. Because again, I don't believe that the cookie cutter approach works in every patient. You have to modify it according to your patient. So coming back to the post-COVID, a lot of the time you'll hear patient will say, I still have a cough. For a lot of those patients that have allergies in the past, we have seen a lot of bronchospasm. And if we do the pulmonary function testing, we do see some amount of bronchodilator response. So adult onset asthma post-COVID has been very well seen in the practice. So that is something you have to keep an eye open for, that these patients may need bronchodilators. And if they have allergies before, then, as you know, there's some evidence of Montelukast helping with the cytokine storm syndrome. And it also helps post-COVID, especially in our asthmatic and allergic rhinitis patients. So that's one thing I would say as far as the airway is concerned, to look into, number one, pulmonary function testing, number two, bronchodilators, and also Montelukast or immune modulatory agents as well there. Looking at the interstitial complications, high resolution CT scan should be done in these patients, and especially 6 weeks to 3 months after they've been discharged, and pulmonary function testing in a 6-minute walk test. Continue rehab. Pulmonary rehab can also help them significantly. If you have pulmonary rehab in your region, if you don't have it, you can come up with a plan, give patients about 30 minutes to an hour exercise to be done every day. And it could be different kind of exercises. It could be, muscle strength exercises, could be walking one step at a time, could be, they can divide it into 15 minutes in the morning and 15 minutes at night. So the rehab certainly plays a huge role in recovery of these patients. If you do find that there are interstitial infiltrates, it helps to know what they are. Are they more like non-specific interstitial pneumonitis? We call that NSIP. Or are they more of UIP picture, usual interstitial pneumonitis? If it's more of a UIP picture, there's more scarring in there, then at that point, you have to decide where they stand in that journey. If they are at 6 weeks, most likely there's some amount of scarring that has developed. And if it remains progressive, and that's why it's an important role of high resolution CT and pulmonary function testing, because if it's a progressive defect, then antifibrotic therapy may be of use. Again, there's no evidence at this point. But a lot of the data we extrapolated from ARDS patients. However, the pulmonary fibrosis that happens with COVID versus what happened with ARDS patients is a little bit different. When we look at the microbiology level, one has epithelial damage and one has endothelial damage. But there has been some data that if on the first week of ARDS patients, if we added pirfenidone, as I'm sure some of you might know, that there are 2 approved therapies for IPF, in general that was approved about 2 years ago in US. One is pirfenidone and one is nintedanib. And both of them, there have been some interest in if that could be used as an antifibrotic therapy. And for ARDS patients, for after first week, and there was some interest that if you could start it, it may prevent fibrosis from happening. But again, there's a lot of data that needs to be done, and the concern would be liver function.
Thank you so much. In continuation, I think you already answered part of the question I was supposed to ask, like for post-COVID patients and pulmonary complications, who qualifies for post-COVID supplement oxygen? And the pulmonary rehab, you already told us about that.
Yeah. So great question. So, most of the data is if the saturations at rest or with exertion is below 88%, and that extrapolates from COPD data as well, that those patients will benefit from supplemental oxygen.
Thank you so much, Dr. Sanober, for sharing your clinical experience. It was nice to have you. I think everybody has been benefited with that. And if you get time again, we might come back to you again. Thank you so much. Dr. Shahid Husain is our third panelist. And now we will invite him and ask him certain questions, which must be definitely regarding vaccines. In context to Nadeem, I want to continue with that what do you think if we have a vaccine available at that time? So you think we could have been avoided ordeal of Dr. Nadine Qureshi, and can you navigate us about it?
Sure. Thank you, Naushaba. Thanks a lot. And I would like to thank Dogana first for having me here today. And I'm so glad to see Nadeem talking, suited, booted, looking as usual himself, though I think he is a bit weak. But that is very powerful message that Nadeem is delivering. I'll just take a minute to go to the background since its inception in Wuhan in December, as we know of. It was, this disease was said to be just like a common cold syndrome, and people did not realize that it is not common cold, it is severe than that. Then the other level that came in was that, oh, it's like flu, because the mortality rate for flu is around about 1 to 2%. So it is flu. But over the course of time, it unfolded its ugly head to us and showed us that it is neither common cold nor it's flu. And as has been stated by my previous panelists, that this is a multi-system disease with serious consequences. And Nadeem has very eloquently stated, and Dr. Sanober has discussed the long haul of the disease. So this is a disease that is not to be taken lightly at all. And you must have, and the other thing that I would like to stress, yes, these are unprecedented times. Indeed, the last pandemic of that sort was in 1911, and then in 2021. So it's almost 100 years, and I don't want to see it again before 100 years. But we should also congratulate the scientific community that when the disease was as clear as mud, they get all their act together, and the unprecedented research that has resulted into the clarity just in a span of 1 year is almost unheard of. There are more than 150 randomized controlled trials that have been published. We started from zero, and now at least there are 12 vaccines that have been in clinical trials, at least of 120 started. So this is a humongous effort from the scientific community that need to be congratulated. When we talk about the vaccines, as I said, there are 12 vaccines in some sort of clinical trials. And one of the gift of this pandemic is the development of mRNA vaccines, to which there are 2, Pfizer, BioNTech, and Moderna. mRNA vaccines are not new. They have been tried in the past in various other syndromes, including Ebola. But in this area, they have been most successful. I'll come to the rates. Then the second group is using a vector, and usually it's the various form of adenovirus, which are not human adenovirus. So this is a point that I want to specify, that they are used as a vector. They cannot infect humans, and they carry the virus proteins for body to react. And there are, their names are Sputnik, which AstraZeneca, Johnson and Johnson. There is one, CanSino, which is still going under trials. So this is the second group. The third group is classical vaccine group, which is the inactivated vaccine, in which the virus is attenuated or inactivated, grown in biological media. This is the traditional way of developing vaccines. So they are Sinopharm, which is the Chinese vaccine, Sinovac, which is the other inactivated vaccine, and then there's other variant of Sinopharm, Wuhan vaccine that is there. Then there's a vaccine from India, which is Bharat. There's another vaccine from Russia, which is called Epivac, and then Novax, which is a recombinant protein vaccines. So what about the efficacy of these vaccines as a general rule? So my perspective on efficacy is a bit different, right? So efficacy in these trials are judged primarily by looking if you get the disease or not. That's what these studies are powered. That if you don't have the disease and you're exposed to disease and I give you the vaccine, whether you go on to develop disease or not. But as clearly evident from Nadeem's experience, that it is not only the getting the disease, it is the sequelae of the disease and extent of the disease that is of paramount importance, right? So when you look at the vaccine efficacy in terms of preventing the disease, Pfizer and Moderna and Sputnik actually from Russia, they are the highest. The adenovirus group ranges from 60 to 86, those four vaccines that I said. And the Novavax, the recombinant protein that is really almost near to be approved, is 86 to 96 minutes. But the most importantly, no matter which vaccine do you use, all of these vaccines in clinical trials has almost 100% rate in terms of prevention of severe disease, leading to hospitalization and death in clinical trials. That is really important. This disease has 20% mortality once you go to the hospital, depending on where you stay on the general ward, or you go to ICU, you get the ECMO, and this latter, the rate of mortality increases. So when people ask me, like, what vaccine do I get? I tell them point blank, it really doesn't matter. This is not a question that needs to be asked. The question is, should I get the vaccine? And the answer is in bold 550 times, yes. Whatever vaccine is available, you should get it, because it will decrease your chances of severe consequences, hospitalization, ICU, long-term sequelae. So it's really important to get vaccine, whether you're getting Chinese vaccine, whether you're getting Mrna vaccine, whether you're getting AstraZeneca vaccine, it really doesn't matter.
Thank you.
So I'll stop here because I think I'm running out of my time, and
I think, I think, mashallah, I have a couple questions, but you, mashallah, covered everything. So is anything about different variants? Everything is covered with these vaccines?
So there are three known, there are more than 10, 15 variants, but three variants of significance, and commonly they are known as UK, South Africa, or Brazil variants. Of these, UK variant is more common. There are almost 94 countries in the world that have reported these. The only point is, if there is UK variant more prevalent in your community, AstraZeneca vaccine is not as effective. as it is. So it is in the latest New England Journal of Medicine article, it was around about 21 to 22%. But again, you have to keep the perspective. Getting disease is different. Getting severe disease is different. And what
yes,
we want is to prevent serious disease.
Thank you.
This is what people have to understand.
Exactly.
I mean, we all get cold. All of us have experienced cold. Like
exactly.
2 to 3 days, you're miserable and then you're fine, right? That is an
you.
acceptable outcome for me as compared to getting hospitalized and experiencing the ordeal of what Nadeem did.
Thank you so much. Your discussion was so convincing. I think and everybody who hasn't got the vaccine, they will go. Very convincing. And full detail. Thank you so much, Dr. Shahid Husain. And now we have to invite our honorable, loving Professor Zarnaz Wahid. So, Dr. Zarnaz Wahid, it is always pleasure to see you. How are you doing?
Pleasure. I'm so.
Thank you so
much. I'm so proud of whatever from the experts, and I'm so proud of our Dawites. And it gives me. I'm so overwhelmed, and I thank the president for acknowledging us, and especially his effort, and Nadeem Qureshi and the team, and Mrna Sheikh and all those who started with the genomic project, and they're doing really well, and we're looking forward to this lab to be added to our university.
We also as a Dwight are very proud of our mother institute, Dow University of Health Sciences, because you guys took a leading role in fight against COVID in Pakistan. And that's why this is my question to you. Could you tell us this is my question to you, that what initiative did Dow University has taken during Corona pandemic and in Karachi, as most populated city of Pakistan, what capacity building measures university took to manage COVID patients?
Okay, very quickly, the first case came in on 26th of February, and we were the first to get the Korean kit for testing by PCR. And then we knew that we have to establish a test center for testing, and we were the pioneers in PCR testing. We provided it free of cost, and we are still running it free of cost. And as you know, the pandemic was announced in March, I think, 2020. And since then, there has been no looking back. So so far we have done 117,000 tests. And the positivity is just under 30%, to be exact, 27% have turned out positive. But for surveillance purposes, it is an essential element. And we have still continued and will go on doing it for the period that is required. Apart from the testing facilities, we did capacity building and converting all the facilities that we had at Civil Hospital, at Dow University Hospital, at OICD, which is OJA Institute of Chest Diseases. We converted these areas into quarantine isolation areas, and then all the HDUs and ICUs were converted into corona giving facilities, and they were, mobilization of ventilators towards these facilities. And then in capacity building, we got in the equipment, the PPE, which was very difficult at one go to get so many. And then we inducted faculty and consultants of infectious diseases were inducted in our faculty. Then we took critical care consultant in addition to pulmonologists and technicians and paramedics. We inducted them, and it was quite costly, but we managed it, and we started giving the admissions. And fortunately, at the same time, we started building on a purpose-built hospital for infectious diseases. We could see that these facilities which we make on shift would not serve for long term. So we thought of having a specific hospital for such episodes. If we have a pandemic or an epidemic, we cannot just close down the regular facilities and convert it into corona facilities for a longer period. So all that we did that, and simultaneously we started research on the molecule of the virus, its structure, how it attaches to our genes. So we started our own laboratory in the molecular laboratory, but at the same time, we got ourselves registered with Drug Regulatory Authority of Pakistan to do study on the convalescent plasma to extract out the specific IgG, IV immunoglobulins, and that we got registered and started out with the laboratory testing. And we were fortunate to get ourselves registered at a record time. And we started working on that. So this was regarding the capacity building. We provided for everything, but there were bottlenecks because you see there is the stigma. The society does not understand the importance of early detection, the early reporting. They would report very late because there was a stigmata that society will not accept us. They will sort of abandon us, and they would, if somebody had corona, they would hide it. They would not share it because there was a fear that this area would be, would be a smart lockdown in that area. All these problems were there at the patient's end. And when they entered the hospital, they were very critical. And then there was a fear of the patient that they would not want to go to the hospital because they felt that the hospitals are all geared to put them on ventilator. And once the patient goes on ventilator, they never come back. So these myths were there.
You guys worked hard. You guys been through so much, and we are proud of you. And you didn't tell us that your successful story, that how your IVIG was picked up by Pakistani Air Force and they sponsored it. Mashallah, that was a very successful story. Congratulations, guys.
Yes,
we are proud
there
of
is success story. There, amazing.
I think somehow Dr. Zarnaz has been, the computer is freezed. I will go to the next panelist, Mr. Abdullah Butt. Oh, she's back. Mr. Abdullah Butt. Oh, sorry, it was, yeah. So thank you so much, Dr. Zarnaz. We will start question answer session. I think Shahid has some questions, but let me finish with Mr. Abdullah Butt, and after that we'll start question answer session.
I think, Dr. Naushaba, we should let Dr. Zarnaz tell about the Air Force story. That's a very, very excellent achievement by Dow.
Actually, I do want to hear too. Thank you so much. Let's do it.
Okay, so the IVIG had 3 stages. First was the laboratory, then the patients, we took, the second phase was the patient study, and luckily we came out with success. It was very effective, 100% efficacy in seriously ill patient and 56.5% efficacy in critically ill patient. So luckily we are now in the 3rd phase, and the 3rd phase is involving 310 patients. And it will take, basically it is focusing on the efficacy, so that after 3 or 4 months, it will take to complete the 3rd phase of our human trial. And then we will go for commercialization. And there's another good news that we are going for mRNA vaccine, hopefully. And you pray that we innovate it to be effective against multiple strains of corona rather than just one. Thank you.
You are in our prayers. We are proud of you. Hats off. Good luck. Thank you so much. Thank you so much.
God bless you.
Thank you. God bless you too. Mr. Abdullah Butt. So I'm going to invite Mr. Abdullah Butt. I know that you have a very successful eDoctors program. And this Dogana is collaborating with you in that program. And all those eDoctors are trained in Stanford University in California. And we just want to know that I was interested to know like the process. How did you manage all that contact tracing and isolation? I put it all together.
Thank you very much. Thank you very much, Dr. Naushaba, and thank you very much, Dogana. It's an honor for us on behalf of eDoctors and Educast to be asked to join this respectable panel. Thank you very much. Our story goes back to February when the pandemic started. Basically, eDoctor is a program, just for people who do not know, eDoctor is a joint program with Dow University of Health Sciences and Educast. It's an academic technology collaboration, and in matter of last 2.5 years, we have brought back non-practicing doctors, about 1,000 of these non-practicing doctors from 24 countries, Pakistani licensed non-practicing doctors, back into the practice. So when the pandemic started, we had approached the authorities, knowing that the authorities will not be able to handle it because there was a dire shortage of doctors and dire shortage of knowledge. We were already working with Stanford Center for Medicine already for infectious disease and mother and child health. So jointly, we approached the authorities and offered them our support voluntarily. And since April until today, we are managing the entire Sindh province, which consists of 70 million people. And day in and out, we are managing the entire home isolation patients from the day they get COVID positive and the day they get their mandatory 14 days discharge. In this process, we have encountered certain issues, and we have definitely learned a lot. There are about 450 of our eDoctors from 14 countries who are participating in this project with us, and we are managing in collaboration with authorities and of course with support from our healthcare experts. Coming back to what experience we had in this process was that people were in denial phase, and today also they are in a denial phase. They don't give right information for the data. When they go for the blood test, for the PCR testing, they do not give proper data. And for that, when the data comes to us for a COVID positive patient, and we start looking for contact tracing or for home isolation telehealth monitoring, we were not able to get them. So as high as 50% of the data was not able to be, not being able to access because of the wrong information we had. So our team, in collaboration with the district health authorities and the district management, we took a bold step and we started contacting them through the local district authorities and traced them out. And also, while tracing their correct addresses, we took the help from NADRA, from the National Database Authority, by tracking them down, and then we put them on monitoring through local district authorities. This was done in very early stages when the pandemic was growing. At that time, we had about 20,000 people, 20,000 only people, because there was a fear that there will be a very, very heavy, pandemic effect. But thank God that it helped, our strategy helped, and thanks to our eDoctors and thanks to, of course, the technology and the academic excellence from Stanford, we managed to do the contact tracing properly. And as we talk today, Alhamdulillah, by grace of Allah, we have managed to handle about 150,000 patients from day first to day out. So we have the data of those 150,000 patients today for all the COVID patients out of Sindh province. And as we speak today we have got about 4,000 patients only as today.
Oh, wow. Thank you so much. It was really encouraging to hear Educast development and contract tracing journey. Keep up good work. Thank you so much. And we really are proud that Pakistan is advancing in digital technology, which is our future. Special thanks to Mr. Abdullah Butt and Professor Zarnaz Wahid, because you guys are updating us from Pakistan. And after that, I do want to ask few questions, session answer. I think we saw raise hand from Bina, from Dr. Shahid Husain and Sanober, I think. So can you guys mute one by one each person so they can ask the question? Thank you. Very short and brief, time is almost there. Can you do it? Bina, do you want to ask the question?
Assalamu alaikum. Can you hear me, Naushaba?
Yes, I can hear you.
Okay. I just wanted to know how is the situation there, because there's a huge lockdown in Punjab area. So what about Karachi and Sindh?
I think Dr. Zarnaz Wahid should answer that.
Yes. Hello.
Assalamu alaikum, Dr. Zarnaz.
Thank you very much for showing concern. Luckily, Punjab जितना हमें अभी affect नहीं कर रहा है. The second wave is very rapidly affecting us, and we are getting quite a few positive cases. But अभी कराची में वो हालात नहीं है जो इस्लामाबाद में हुआ है. Like 700 cases have been reported in one day. We are not in that belt so far, but we are preparing ourselves for this. Will be our third wave is right around the corner, we can say. But अभी लॉकडाउन वगैरह नहीं हुआ है, and we go for smart lockdown. Like जब कोई पॉजिटिव आता है वो हम लोग उसके कॉन्टैक्ट ट्रेस करते हैं, and जैसे अब्दुल्ला भट्ट साहब ने बताया, हम उनको नादरा की वेबसाइट से जाके उनका एड्रेस देखते हैं और वो गली और वो मोहल्ले में फिर वो हम लोग स्मार्ट लॉकडाउन, यानी that only that area or that 3-4 houses where there are positive cases, we cordon them off, and then we surveillance is done. And when they are negative and that area is clear, then we open it to common public.
Thank you so much.
That's good to know, because I'm planning to come to Karachi also. So I was, आप लोगों ने बहुत अच्छा मुझे encourage किया.
Very good, and God has been very kind to Pakistan.
Alhamdulillah.
We have been hit that bad by Corona as compared to the American statistics that we come across. Italian, and even our neighborhood, India, has been hit that bad, probably because of their cultural, lack of meat, megaloblastic anemia, which makes them prone. But all the demographics are the same in India and Pakistan, and we have fared off so well. So
I think we are very impressed with Dr. Zarnaz updates, and now Bina can go to Pakistan. And who is second? I think Dr. Shahid. We just have like a very short, brief question, please. We are almost ending now. Can you ask Dr. Shahid Husain?
No, sorry, sir, that was a mistake. I lowered my hand. Okay.
So you lowered your hand. Dr. Sanober Kable, did you raise your hand? You didn't raise. So any other question? What do you think? If no question, so we can end it.
One point I would like to mention, Dr. Saiba. As Dr. Zarnaz rightly said, that God has been very kind to us. God has been very kind to us in Pakistan especially. But to tell you honestly, हमने कोई कसर नहीं छोड़ी थी कोरोना को वेलकम करने की. अल्लाह ताला ने बचाया हमें.
Yeah, you're right.
There were 10,000 people at the beach normal days, right? Today I went to civil hospital to SIU2. I could see in one room there were about 700 people in that room, SIU2 OPD 14 with no mask and nothing.
Wow.
So Allah Ta'ala ne hi bachaya hai.
So there are some questions in Q&A, question and answer around there. There's one question is from Dr. Zarnaz is, what is the status of vaccines in Pakistan?
Oh, we have started vaccine all over Pakistan, and we have completed the health workers, and the frontline workers have been completed, and now we are giving it to the age 60 and above. So this has just started. We have done the second shot for the healthcare workers, and the first is underway for the elderly. And we are doing it quite well, and there is no shortage of vaccine, and there's no shortage of centers giving out vaccines.
Thank you so much. So in question answer session, people are saying thanks to Dr. Zarnaz, Mr. Abdullah. Thank you very much for updating us. Before ending our program, I just want to give a little message to our general public. Please mask पहनना, ventilator mask पहनने से बेहतर है. घर में रहना, ICU में रहने से बेहतर है. हाथ धोना जिंदगी से हाथ धोने से बेहतर है. एहतियात करें कि एहतियात इलाज से बेहतर है. In the end, I want to thank each and everyone who is present, our panelists, especially Professor Nadeem Qureshi, Professor Shahid Husain, Dr. Sanober Kable. Very, very special thanks to Professor Zarnaz, Wahid, and Abdullah Butt. You guys joined us from Pakistan. We're really, really thankful to you. You guys shared your experience, your expertise. You gave your special time to us. We are really thankful to you. And very special thanks to our team, audience also, who are there early morning and late night, and they are with us. If the audience is not there, the Zoom programs, they are useless. So, and our team, including our team is Lakes Siddiqui, who is our media media manager. He was here with us whole day to make this program as smooth as possible. I really thank you, for helping us all the way. And second, I want to thank Dr. Nadeem Qureshi, which is our mastermind. His guidance, his help, his criticism too, take us to the best of our, we do our best with that. The best thing about him is that he's just a call away. He just help you whenever you call him, he's just there. So thank you so much, Dr. Nadeem Qureshi. Last but not the least, our president, Dr. Irfan Aslam. He is our energy. You gave him any project, he will jumpstart it, he will lead it, he will make it happen as a team. And we are looking forward to work with him in the coming year to 2020-2021. And we are proud of you. We love you. Best of luck. Thank you. Allah Hafiz. Pakistan. Zindabad. Thank you so much. जो मुझसे गलतियां हुई हो माफ कीजिएगा. Excellent.
You did a great job.
Thank you so much. It was really lovely seeing you guys. Thank you so much.
Thanks a lot.
Thanks a lot.
Thank you.
Thank you, Dr. Nadeem Qureshi. Take care of you.
Thank you. Jazakallah khair. Thank you. Thank you, everyone. Thank you.
Okay.